Assalamu alaikum warahmatullahi wabarakatuh. As you all know that we have three different types of jaundice. The one that is occurring before the liver, this is liver. The before the liver, this is prehepatic jaundice. And the jaundice which is due to some disease affecting the liver, this is hepatic jaundice. And the jaundice which is after the liver, before the liver, in the liver, and after the liver, this is the post hepatic jaundice. So you all must know that you will be knowing that the first of all the RBC come into the liver. There is the first breakdown of this RBC, due to which the hemoglobin comes out. When the hemoglobin comes out, it enters into the liver where it is metabolized into the bilirubin. Now in the liver, the bilirubin is conjugated, and then it enters into the bile duct through the active transport. The hemoglobin enters into the liver through facilitated diffusion, this point. And when the bilirubin is conjugated into the liver, it enters into the bile duct through active transport. So you must know these two types of transports and the differences between these two. So this is a basic hepatocyte, and it contains ALT and AST. In hepatocyte, two enzymes are present, AST and ALT. And in bile duct, this is the bile duct and this is the gallbladder. And in the bile duct, the cells of bile duct contains ALP and GGT. ALP is alkaline phosphatase and GGT is gamma glutamyl transpeptidase. And this AST is aspartate transaminase and alanine transaminase. And you can see this is an RBC which contain hemoglobin and LDH. LDH is lactate dehydrogenase. So what happens in prehepatic jaundice? In prehepatic jaundice, there is the hemolysis of RBC. There can be many reasons of hemolysis and resultant prehepatic jaundice, one of which is G6PD deficiency, pyruvate kinase deficiency, and hemolytic anemias, and some drugs that are destroying the RBCs. So whenever there is the defect in the is in the hemolysis of RBC, the resultant jaundice is prehepatic jaundice. And whenever there will be the defect in RBCs, this LDH will comes out. So this LDH will comes out and hemoglobin will come out. So when the hemoglobin will come out, it will enter into the liver, it will be conjugated, it will be secreted, it will enter from the gallbladder, it will enter into the gut, from the gut it will enter into the kidney. So urobilin will be secreted in the kidney more, and stercobilin will be secreted in the fecal matter more. So there will be the darkening of fecal matter, there will be a darkening of the urine, and there will be increased LDH. While the hepatocytes are normal and the bile duct cells are normal, so AST, ALT, ALP, and GGT enzymes will be normal in this type of jaundice. So whenever you see the lab reports in which the HB is low, why? Because there is a hemolysis and LDH is raised, the bilirubin is raised, and in urine the urobilin is raised, and in stool the stercobilin is raised, and the color of urine is dark urine, and the color of the stool is dark colored stool. So this type of jaundice will be the hemolytic jaundice or the prehepatic jaundice. So whenever the second there is some defect of liver, for example there is the hepatitis, there is alcoholic liver disease, or there is hemochromatosis or alpha 1 antitrypsin deficiency, or there is liver carcinoma, that is hepatocellular carcinoma, what will happen? The defect will affect these hepatocytes. Now the hepatocytes will break. Whenever there is some disease affecting this liver, the hepatocyte will break. Now when the hepatocyte will break, the AST and ALT will comes out, as these two enzymes are present in the hepatocyte. Now remember one thing, that AST is liver sensitive. It is not specific. ALT, remember from the L that ALT is liver specific. This means that ALT is present only in the liver, and AST is liver sensitive. This means that ALT is present in liver, cardiac enzyme, and skeletal muscles. So if there is any disease affecting the liver, AST can be raised, or if there is any disease affecting the cardiac muscle, AST can also be raised, or if there is disease affecting the skeletal muscles, AST can also be raised. But if the disease is affecting only the liver, AST will be raised along with ALT. While in these conditions, when there is some disease affecting the skeletal muscles or the cardiac muscles, AST will be raised, but ALT will be normal. This is the basic difference that will lead to the diagnosis of the questions that I sent in the group. So this means that whenever there is this hepatic jaundice, AST plus ALT both must be raised. So, if only one of them is raised, for example, if only AST is raised, ALT is normal. This means that this type of jaundice is not hepatic jaundice, because the patient with some type of jaundice may be suffering from the liver disease. ऐसा भी हो सकता है कि बंदे को जॉन्डस हो, हिमोलिटिक जॉन्डस, और उसको साथ कोई कार्डिक इशू चल रहा हो जिसकी वजह से उसका AST भी रेज्ड हो, बट ALT नॉर्मल हो। अगर AST और ALT दोनों रेज्ड होंगे तब हम उसको लेबल करेंगे हेपेटिक जॉन्डिस। Similarly, when there is some defect in the bile duct, for example, when there is some stone obstructing the bile duct, the cells of bile duct, these cells that contain ALP and GGT, they will be destroyed, there will be damage, so these enzymes will come out. Now ALP is present also in the placenta. You can see from here, it is present in the growing children, it is present in the bile duct. This may, there may be condition that the patient is suffering from hepatic jaundice and the patient is pregnant. अब प्रेग्नेंट पेशेंट के अंदर अगर हेपेटिक जॉन्डिस होगा, AST ALT रेज्ड होंगे होंगे, ALP भी रेज्ड होगा. Why? Because the placenta also contains ALP. So you must remember that in this case the ALP will also be raised. And then there is the GGT. The gamma glutamyl transportidase also has different isoenzyme that are present in the different parts of the body. So so along with that, along with this, this may happen. So अगर आपके पास, if there is the disease affecting the bile duct and the jaundice is post-hepatic, both ALP and GGT must be raised. If only ALP is raised, this means the jaundice is and GGT is normal, the jaundice is not post-hepatic. If only ALT is raised, AST is raised and ALT is not raised, this means that the jaundice is not hepatic. So, for example, if GGT is normal, ARP is raised. This means that jaundice is not post-hepatic. If AST is raised, ALT is normal. This means the jaundice is also not hepatic, and सो द जॉन्डिस विल बी प्री हेपेटिक. ये मैंने क्वेश्चन भेजा है ग्रुप के अंदर, इसमें ALP रेज्ड है, AST रेज्ड है, ALT नॉर्मल है, GGT नॉर्मल है. इसका मतलब है ये दो जॉन्डिस नहीं हो सकते. अगर इनमें से कोई टाइप का जॉन्डिस होता तो उसका जो काउंटर एंजाइम है वो भी रेज्ड होना चाहिए था. सो दिस मीन्स द जॉन्डिस इज प्री हेपेटिक. उसके अंदर LDH की जिक्र नहीं किया गया. सो यू अपने आप लोगों ने उसको माइंड को थोड़ा सा घुमा के सोचना था कि अगर ये दोनों होते तो दोनों रेज्ड होते. सो दिस इज़ द बेसिक डिफरेंस दैट आई वांटेड टू टेल यू, and you must know these enzymes, their locations and the differences. So when there is the hepatic jaundice, the disease affecting the liver, AST will be raised, ALT will be raised. Now the defect is because in the conjugation, the enzyme that conjugate is urididyl UDP glucuronosyl transferase that adds the glucuronic acid to this bilirubin that result in their conjugation is excretion in the fecal matter and urine. So now what happens, जब conjugation नहीं होगी, this step will be blocked and the backup of bilirubin will occur. So unconjugated bilirubin will be present in the blood, and from the blood, the unconjugated bilirubin will enter into the oh, will enter into the kidneys, which result in yellow urine. But it there is obstruction here. There is no conjugation, so it cannot be excreted into the bile duct, and from the bile duct it cannot enter into the gut, so the fecal matter will be light colored stool. इसी तरह जब आपके पास whenever there is obstruction, the conjugation तो normal हो रही है, the conjugated bilirubin will enter into the blood. From the conjugated bilirubin it will enter into the kidneys. किडनी से ब्लड से फ्लो अच्छा होता है तो चला जाता है, लेकिन आपको गट में जाने के लिए बाइल डक्ट के थ्रू ही जाना पड़ता है. तो बाइल डक्ट के थ्रू गट के अंदर बिलिरुबिन कम जाना शुरू हो जाएगा, यूरिन में ज़्यादा शुरू हो जाएगा. यूरिन डार्क कलर्ड होगा, लेकिन आपको जो फीकल मैटर है वो लाइट कलर्ड होगा. सो इफ़ देर इज़ रेज्ड बिलिरुबिन इन द ब्लड with yellow urine and light colored stool, this means that it can be post hepatic jaundice or hepatic jaundice. while that in case of prehepatic jaundice the stool will be dark colored. So these are the basic differences related to the enzyme deficiencies and enzymes that I wanted to tell you, and this is the basic concept that you must know before solving the MCQs. So jazakallahu khair wa ahsan al jazai fi darain.